In July of 2022, I had a heart attack and then had to have some stents afterwards. And it was highly recommended that I go through a rehabilitation process to build strength and stamina back up.
My doctor sent me to a specialist, a pulmonary specialist. And come to find out I had a COPD, extensive lung damage. I need a double lung transplant.
We have two programs here at Norman Regional. We have our cardiac rehab program and our pulmonary rehab program. They both start in the hospital setting, which we call phase 1, which patients are visited by our registered nurses and our respiratory therapist. They go over some patient education in there and then direct them over with a referral from their physician into our phase 2 program.
The intake process, when you come in, you sit down, you'll visit with somebody from staff, they'll review what's happened.
Nursing staff or respiratory therapy staff evaluates where they're at their baseline, and then they develop a plan for them, and it changes as they go. So they're always trying to grow that patient.
They'll sort of escort you through and take you to all the different exercise machines.
They make sure that everything is something that you can do. They don't overload it. It's done at a pace that you can handle.
We provide, continuous heart monitoring while the patient is exercising so that we can assure the rate and rhythm, making sure they're having a safe and effective workout. And we are looking at helping to modify risk factors like high blood pressure, managing diabetes, controlling stress, smoking cessation, diet, nutrition, and of course, exercise.
I went through the 36 weeks, and now I'm in phase 3. So my doctor, which is a lung transplant doctor, they want to know every time they see me, am I working out? Am I going to the program? Am I using the tools?
Phase 3 program is for our patients who have graduated phase 2.
You're still doing the same things at the same place where you were, but you're not wearing a monitor. Now, the staff's here if you have a problem. They're just not looking at a scan of your heart and all that while you're doing it.
Our phase 3 program also develops a community here between the other patients that are here. They love our staff, and you can tell anytime you're in here that it's just a great environment. Our cardiac rehab patients are scheduled on Monday, Wednesday, and Friday. Our classes are hour sessions, and we have 12 or less patients per session. Our pulmonary classes are on Tuesdays and Thursdays. They're an hour-and-a-half sessions, and there's 8 or less people. Those sessions, your oxygen levels are being monitored, and they also do some free weight exercises to help build up their endurance. Our cardiac program is nationally accredited, and so that is a very strict set criteria that we follow.
If you have any type of heart or respiratory issue, you need to be in here. And I think you can improve your life.
If your doctor prescribes these types of programs, please don't be ashamed to show up and get the advice and the knowledge and the help that you need. This is the program. I love it.
You're a little bit nervous and worried after you have an event like that. It can be life-changing. It's always good to find something that is reassuring to you after you've had that type of event. And this is a very reassuring place. It's a very reassuring program. These people that work with you, they care. And that's a very important component of all this, is to know that, that somebody's looking after you.